On the evening of Saturday, September 7th, 2024, Montgomery County Fire and Rescue crews were dispatched to a building fire in Silver Spring. Upon arrival, crews found an outside fire that extended into a storage room. While other personnel were engaged in fire suppression activities, the driver of Paramedic Engine 701 and the crew from Ambulance 701 were approached by a female who appeared to be disoriented and bleeding profusely. The patient collapsed to the ground. Paramedic Engine 701's driver and Ambulance 701's driver crew performed an assessment and discovered that the patient had been stabbed multiple times in the back, both sides of the neck, and the left arm. The crews requested a second medic for assistance and an EMS duty officer to bring whole blood to the scene. The crews rapidly treated the life-threatening injuries. To control the bleeding, an Israeli bandage was applied to the patient's left arm, and chest seals were applied to the lacerations on the patient's neck and back. The crews also started an IV and placed a nasopharyngeal airway. The crews obtained vitals and found the patient to be tachycardic and extremely hypotensive. The patient was packaged and moved to the EMS unit to prepare for transport to a trauma center. Due to the patient's condition, a unit of whole blood and TXA were administered via IV pump while en route to the hospital. The patient's condition began to stabilize after administration of the blood and medication. The patient was normotensive and her pulse rate decreased. The crews worked together to monitor the patient's condition and vitals as well as reevaluate interventions. Upon arrival to Suburban Hospital, patient care was transferred to the trauma team. The patient was treated in the trauma bay for her injuries and received additional whole blood. The patient was admitted and underwent multiple surgeries during her stay. The patient's condition continued to improve throughout her admission. Thanks to the knowledge, skills, and the crews on the scene were able to transition from fire suppression activities to providing life-saving medical care of a critically injured patient and excellent care from Suburban Hospital. The patient was discharged on September 23, 2024. Montgomery County Fire and Rescue Service is proud to recognize our personnel for their dedication, professionalism, and teamwork.